basically what we do here is we assist people with getting registered for the medical cannabis card. So, as we all know, it's been a long time coming, so it's a good time to celebrate because now we have alternative medicine. So the medical cannabis comes in many different forms. It's not just flower related. It's going to be coming into capsules, different other ointments and different things, and that's what we're going to get into in the presentation. So, all right. So if you could, hold your questions to the end, that'd be awesome, because I might answer it as we go throughout. So basically, as I just stated, most of the cannabis ailments that's treating for pain, chemotherapy, hepatitis C, AIDS, spinal injury, glaucoma, and cancer. So cannabis is the medicine, and it just started to be legalized now in Maryland this year, 2017. And people that can register, so patients, caregivers, providers, and dispensaries. So not only if you need to take it yourself, but you might be a caregiver and you take care of somebody else who maybe have to get the medical cannabis or interested, you can register yourself as a caregiver to take care of that person as well. So that's also involved. And so I have here these two screens, which I'm going to talk about at the end of the workshops. And this is the Maryland Medical Cannabis Program at a glance. And this is the Maryland Medical Cannabis Commission. And I want to thank them for allowing me to be able to assist people with getting registered for their cannabis thing. So, yeah. So this website is a really big key to your registration and how you're going to get registered and all those great things. So before we go into that, what is a patient? That's someone who is diagnosed with a medical condition. What is a dispensary? And you need to be understanding it is a difference. So your doctor, some places where you go, they might have it available, but it has to be a licensed dispensary in order to provide you with the cannabis in Maryland, in the state of Maryland. But basically a dispensary acquires, possesses, processes, transfer or transports, sell, distributes, dispenses any cannabis related supplies. Now, cannabis, as I said, it comes in many different forms. They're going to have it in creams. You'll be able to have it in the flowers where you can be able to smoke it. Edibles, which is not yet regulated in the state of Maryland, and also capsules as well. So qualification. So who is authorized by the commission to provide cannabis? So in order to provide it, the only people that can provide it to you is your provider that's registered with the Maryland Medical Cannabis Commission, caregivers, process dispensaries, and independent testing labs. A qualifying patient may be a patient or the certifying physician, or may be referred to the certifying physician. What is a qualifying patient? So a qualifying patient is a person that has been provided with a written certification by a certifying doctors. A lot of questions I get when people call me, they say, well, my doctor said that I should get it. So I shouldn't have a problem once I'm registered that my doctor can get it. Well, that might be true if your doctor is registered. So if your doctor is yet not registered and interested in providing you with that alternative medicine, then you might want to talk to them and ask them to become registered so they can treat you. If not, we have doctors that we can connect you to that are certified and that can provide you with that your certification. Now, and that goes to the next thing, you need to be able to create a bona fide relationship with a physician. So you want to be able to have that relationship because they don't want you to just go in and get a prescription. They want your doctor to monitor you to the point to eventually that you might not need any medication, because that's what they're claiming that this medication can do. Eliminate your ailments, take away your illness, or, basically, cure it. So your doctor wants to evaluate you throughout your process to see if the medication is working, to know what dosage to give you, to know what form to prescribe your medication in. And if you're under 18, you have to have a caregiver for that. Now, what's next? After you go through the process of finding a doctor, a certified physician shall provide you with a written certification for the commission on a receipt. That's a written certification. The commission shall issue an identification card to each qualifying patient or caregivers in the name of the written certificate. A certified physician may discuss medical cannabis with the patient. 7 diseases that medical cannabis cure is epilepsy and seizures, asthma, HIV/AIDS, Alzheimer, multiple sclerosis, menstrual cramps, inflammation valves, or diseases. Now, medical cannabis cures over 700 different illnesses. So if I don't list them, or if you don't see them, it doesn't mean that it's not, regulated. But based on the commission, the Maryland Medical Cannabis Commission, Natalie M. LaPride. The illnesses that you can have are listed here, and they include severe or chronic pain, which I'm in chronic pain. Severe nausea, seizures, severe or persistent muscle spasm, and I also qualify for that because I was in a car accident. So if you've been in a car accident, major injury, personal injury, neck, and even PTSD, depression, and other things of that nature, which again, you want to speak with your doctor about that. You want to be as honest, as open as you possibly can, so he could be able to give you the medication based on your needs. Registration, the patient registration is now open. Any Maryland resident whose provider approves medical cannabis as a treatment option for any qualifying medical condition is eligible to register for the MMCC as a patient. Non-medical residents, non-Maryland residents, sorry. So if you're non-Maryland residents, you are currently living in Maryland for the purpose of receiving medical treatment, you're still eligible to register as a patient. So you can let people know that. The non-Maryland patients must have the address and a contact name for the medical Maryland center that actually gave them the prescription. So if they live in Suitland, but they have a DC address, but they've been living with you in Suitland and they got hurt in Suitland or in Maryland, they have to take those documents from that Maryland hospital or facility to that doctor to be seen in Maryland. Qualifying medical conditions include, again, Waiting syndrome, chronic pain, and post-traumatic stress disorders, glaucoma, and more. So as you go on, you get more stuff. So our motto here is where beauty is power and health. And this is where you can follow us on Facebook to learn more about our programs. We're going to have a lot of different workshops coming up. You asked me about far as being able to receive that. We do work with a lot of vendors in DC where you can actually go to DC if you need to get something for now. But Maryland, you have to go through a process, and it takes about 10 days once you are registered and you get your number to actually be seen by a doctor once you get an appointment. Once you get that appointment, then the doctor can evaluate you and give you your certification, and then you go and you can either get your medication that day, or you have to come back for treatment and for him to prescribe you more. And that's basically it. So this is my website, which also has all the events that we're going to be doing, educating people about cannabis, as well as our email here, which is marylandcannabisregistrationaid@gmail.com. Our website is crystalisbusiness.com, and you can follow us at assistance with enrollment for the Maryland Cannabis Medical Card. And this is also my telephone number where you can contact if you need to book an appointment. But if you have any questions, I'm free to answer.
I ain't got a question. Let's see. Well, my situation is like I said, my address is in DC, but I live in Maryland.
Okay.
And as for a lot of the stuff you was talking about, I'm already on that list and I already have documentation for it. You know, I have documentation for the depression, the glaucoma, chronic pain. You know, I get cluster headaches, asthma.
So it sounds like you're a good candidate. So I mean, today the next step, if you guys don't have any questions, we can assist you with getting registered. And it's $75, and we can assist you to now. We have computers in the back where I can set you up. We can get you started, and you'll be on on your way to getting your
Well, we got
cannabis
your
card.
information. It's first of the month. Bills was due, so I don't have another paycheck until